This is PediaCast.
Welcome to PediaCast, a pediatric podcast for parents. And now, direct from the campus of Nationwide Children's, here is your host, Dr. Mike.
Hello, everyone, and welcome once again to PediaCast. It is a pediatric podcast for moms and dads. This is Dr. Mike coming to you from Nationwide Children's Hospital. We're in Columbus, Ohio. It's episode 536 for April 26th, 2023. We're calling this one Water Safety and Drowning Prevention. I want to welcome all of you to the program. We have another important topic for you this week, and it's one that we cover just about every spring because we all need a refresher as we head into warmer weather, especially for those of us who get to experience all of the seasons and haven't really thought about swimming since Labor Day. But it's also important for those of you who get warm weather all year round because sometimes we forget the principles of water safety and drowning prevention if we haven't heard or thought about the rules in a while. And this information really can be life-saving. Did you know that drowning is the number one cause of injury-related death in kids under 4 years of age? And it's preventable. Also, during the summer here in the United States, a child drowns in a portable pool. So think about those little kiddie pools in the backyards. One child drowns about every 5 days in the summertime. And so just over a week, we have a child who dies in one of those little kiddie pools every week somewhere in the United States. And we don't want that to happen to your child or to any child. And so there are really important rules and tips to keep in mind as we try to make each summer safer than the last one. And that is why we cover water safety nearly every spring. We're also honored to have Dr. Sarah Denny with us again this year. She is a primary care pediatrician at Nationwide Children's and a former member of the executive committee of the Council on Injury, Violence, and Poison Prevention for the American Academy of Pediatrics and lead author of a 2019 policy statement from the American Academy of Pediatrics called Prevention of Drowning. She also directs advocacy education for residents at Nationwide Children's. We'll talk more about what that means in a little bit. She's bringing one of our pediatric residents with her, Dr. Ali Sawani, as we consider water safety and drowning prevention. We will get to them shortly, but first, let's cover our usual reminders. Don't forget you can find PediaCast wherever podcasts are found. We're in the Apple and Google podcast apps, iHeartRadio, Spotify, SoundCloud, Amazon Music, and most other podcast apps for iOS and Android. If you like what you hear, please remember to subscribe to our show so you don't miss an episode. Also, please consider leaving a review wherever you listen to podcasts so that others who come along looking for evidence-based child health and parenting information will know what to expect. We're also on social media. We love connecting with you there. You'll find us on Facebook, Twitter, LinkedIn, and Instagram. Simply search for PediaCast. We also have a contact link at PediaCast.org if you would like to suggest a future topic for the program. We always love hearing from you. And I also want to remind you the information presented in every episode of our program is for general educational purposes only. We do not diagnose medical conditions or formulate treatment plans for specific individuals. If you have a concern about your child's health, be sure to call your healthcare provider. Also, your use of this audio program is subject to the PediaCast Terms of Use Agreement, which you can find at PediaCast.org. So let's take a quick break. We'll get Dr. Sarah Denny and Dr. Ali Sawani connected to the studio, and then we will be back to talk about water safety and drowning prevention. It's coming up right after this. Dr. Sarah Denny is a primary care pediatrician at Nationwide Children's Hospital and an associate professor of pediatrics at The Ohio State University College of Medicine. She has a passion for keeping kids safe from dangers such as drowning and advocates for pool and water safety at the state and national levels. She's a former member of the Executive Committee of the Council on Injury, Violence, and Poison Prevention for the American Academy of Pediatrics, and is a lead author of a 2019 policy statement from the AAP called Prevention of Drowning. She also serves as co-director of resident advocacy education at Nationwide Children's Hospital and enjoys teaching new pediatricians how to effectively advocate for patients and families. Dr. Ali Sawani is a pediatric resident at Nationwide Children's Hospital. He too has a passion for keeping kids safe and is sharpening his advocacy skills as we consider water safety and drowning prevention. We cover this important topic just about every spring. Before we get into it, let's give a warm PediaCast welcome to our guests, Dr. Sarah Denny and Dr. Ali Sawani. Thank you both so much for being here today.
Thanks for having us. It's great to be back, and I'm so glad we're talking about this important issue.
Yeah, thank you for having us. It's this is a podcast I listen to regularly, so it's like a dream come true to be on.
Well, we really appreciate both of you taking time to be with us. I wanted to start, and this, I know I gave you guys a list of the questions that we were going to talk about ahead of time, and I'm not sure if I put this on there or not, but I wanted to mention that, Ali, you're a pediatric resident. Can you just remind the listeners what exactly is a pediatric resident? What does it mean to be a resident physician?
Yeah, absolutely. So pediatric residents are physicians that have graduated from medical school. So we're now in the process of getting our training to become fully licensed pediatricians. So we practice under fully licensed supervisory pediatricians while we get our training, and it's usually a 3-year process.
And so you go through undergrad as like pre-med for 4 years, and then medical school's another 4 years. Then you're a doctor, but then you're training in your particular area under supervision there for a few years.
Exactly.
Yeah. And Sarah, we talked about advocacy. What exactly is advocacy, and why is this an important skill for pediatric residents to learn, and also practicing pediatricians too?
Yeah, well, that is a great question because it's such a broad term. And I think when people hear the word advocacy, each one of us thinks about it a little bit differently. But, the bottom line is really it's active engagement to improve something. So in pediatrics, that's really about the health and well-being of children, families, and the communities. And it can look a lot of different ways. So we advocate on the individual level, right? Every time we're in clinic and we're talking about the importance of vaccines or seatbelts or anything like that. But it can extend to the institution, the community, and then the state and federal level, as you mentioned.
Yeah, such really important, and it's what we're doing today.
Mm-hmm.
I mean, we want to keep kids safe, and we want to raise awareness about the dangers of drowning, and how we can all keep kids safe in our homes and our neighborhoods and our communities. And so there's some rules and tips that we want to share today. And I think a good place to start is with some definitions, because there's a lot of terminology out there. You hear drowning, you hear near drowning, dry drowning, close calls in the water. There's like a lot of different words that float around. What exactly is drowning?
That is a really great question. I'm glad you're starting with that because I think there's a lot of misconceptions and misunderstanding about what drowning is. It's really a continuum. It can be from, very mild to not having, any long-term effects all the way to death. It's all drowning, but the outcomes vary depending on how severe and how prolonged that respiratory impairment is.
Yeah. So if a child goes underwater and water gets into the lungs and they have respiratory problems because of that, and maybe they go to the hospital, they're watched for a while, and then they're sent home, is that still a drowning?
That's still a drowning, but it's obviously a non-fatal drowning.
Yeah, right. And I think that you drive home a good point, because it can get confusing, and we want to make things as simple as we can. And even if a person has some respiratory problems and they don't die immediately, you still could have problems, usually within 24 hours. But there could be, you want to watch those kids closely, even though they seem okay right then and there.
Well, usually kiddos who are going to have problems have a pretty significant submersion or immersion and are having symptoms within the first couple hours. It's not a case where the kid looks fine for 12 hours and all of a sudden is acutely ill.
Yeah, and that's a really important point too, because we hear about this secondary drowning or dry drowning, and really those kids did have some sort of symptoms, although they might have been mild symptoms in the initial phase. But certainly once you're 24 hours out, you're good to go, right?
Yes, definitely.
All right. Well, how common does this occur? And I guess since there's such a broad definition, that makes it a little bit more difficult because kids that die from drowning are certainly going to be a smaller number than those who have drowning and have, have to be watched real closely.
Really, the most important thing to remember is in the United States, this is really a big problem. Drowning is the number one cause of injury death in kids 1 to 4. So we see this big peak in that 1 to 4 age group, and then we see a second peak in adolescents. So if you think about the 1 to 4 age group, they're mobile, right? They're running around, they're walking around, they're curious, but they have no sense of danger. They don't understand about the dangers of water. And then in our adolescents, we have sometimes adolescents who may overestimate their abilities. They may just engage in more risk-taking behaviors as a function of their age and developmental stage, peer pressure, and then sometimes substance use is involved as well.
Yeah. Yeah, it really is a big deal. Another stat that I had seen is during the summer in the United States, a child drowns about every 5 days in a portable pool. So we're just talking about those little baby pools or blow-up pools that you can have in your backyard. And I think that because they aren't really deep, sometimes there's a false sense of security, and you might not be paying as close attention to your kiddo as you would if you were at a big pool. But you just need enough water to get in their nose and down into their lungs, right?
Yeah. And that's why, I think this is so important for parents, caregivers, and pediatricians alike, all to be so cognizant of that risk, especially in that 1 to 4 age group. We know that bodies of water, toilets, bathtubs, even a bucket of water from cleaning can be significant risks to little ones.
Yeah. Yeah. So then, Ali, how should parents supervise their kids when they are around water? What are best practices for keeping our kids safe when there's water around?
Yeah. So the short answer is always, like Dr. Denny said, the amount of the water doesn't matter. I was actually surprised. I didn't know before I, started medical school, but even like there's cases of like even buckets of water, like Dr. Denny mentioned, toilets, or even like small amounts of water in the bathtub, kiddie pools, like you mentioned, all those. There's unfortunately been cases of drowning events happening in those small amounts of water. So the short answer is always, we hear a lot of stories about, I just turned my head for a second, or I just went to grab something and then their child was in the pool or anything like that. So anytime your child is around any amount of water, they should be monitored.
Yeah. So that supervision is really important. And if it's just you with your kids in a backyard pool, let's say, you just really have to be there. If you're going to go inside the house, they need to get out of the water, right?
Exactly.
Yeah. And if you're at a public pool where there might be a lifeguard present, it's still a good idea to keep an eye on your kids, because that one lifeguard is looking after the whole pool, where you are going to be paying attention to your individual kids. Now, if you're with a parent group, there's a group of kids there, maybe you can assign one parent to keep an eye on all the kids in your group, as long as they're together in the same location in the pool. And I think it's important to note, too, that drowning ends up being usually a silent thing. Like, you're not going to hear a yell. You're not going to hear a splash to make you want to then look at the pool and see what's going on. Most kids who drown just slip under the water and don't come back up. Correct?
Yeah, exactly.
Yeah. So it's Sarah.
A lot of times when we talk about drowning prevention, as Dr. Sawani mentioned, that supervision, adult supervision, is really key. But we also really enforce layers of supervision. So when you're talking about a public pool, yes, that lifeguard is one layer of supervision, but it doesn't replace that adult supervision of their own child, because exactly what you said, they're watching so many kids, and it is very subtle and very quiet. So, having a parent not think that the lifeguard is a replacement for their own supervision is really important to mention.
And maybe keep your phone, your smartphone in your, I mean, you need it in case, you got to get a hold of someone, but maybe keep it in your bag and not on you so that it's not tempting to check Facebook because, you scroll through Facebook and something can happen in that very short amount of time. And so I think, keep the phones nearby, but away and out of temptation.
Yeah, we talk about, we talk about constant and competent supervision. So you can't take your eyes off them, but you also have to be ready to take action. So knowing what to do, not being under the influence of substances, not being distracted by other people, other things like the phone.
Yeah. One thing that AAP recommends is having a designated quote unquote water watcher. And that's their only job. I know it sounds a little silly, but that's their job. It has a term in it that you're just watching the water. You're not looking at your phone like you mentioned, and you're not, having a drink or anything like that. That's your only job is to be watching the water. So having a designated person is helpful as well.
Yeah, really, really very important. What about life jackets? Are those useful?
Yeah, absolutely. Life jackets, like when you're out on a boat or anything like that, even adults, everyone should be wearing a life jacket. And it's important that it's the right size and even if adults are wearing it, it helps set the example that, everyone should be wearing a life jacket, and they are definitely helpful.
Yeah. On the other hand, if you have life jackets for little kids, like at a pool, and they're bobbing around in their life jacket, maybe it's another layer of protection, but that does not mean that you can't watch. You shouldn't watch, right? Just because they have the life jacket on, don't pick up your phone and scroll through Facebook.
Absolutely.
Right. What about swimming lessons? Are swimming lessons recommended for kids?
Yeah, the AAP actually strongly encourages swimming lessons for parents and toddlers. It's the first step towards water safety. If your child is in any amount of water, they are aware of what to do when they're in the water, and how to navigate. And the AAP actually, the policy statement says most children are ready for swim lessons by age 4, but they can start as soon as they're developmentally ready. So I tell everybody, my niece, she's about to turn 1, and they have some swim schools have parent and toddler swim lessons together. So she's about to start that coming up this summer. So I'm really excited for her to get that experience, and for her to be as safe as possible as well whenever she's around water.
Yeah, absolutely.
Water
Sarah?
competency is really important, and there is evidence that swim lessons, even as young as 1, can help prevent drowning. And again, we talk about the layers of protection. Swim lessons are just one more layer of protection. Just because your child has gone through one session of swim lessons does not make them drown proof. So that supervision is still really important, but it's just another layer that really helps. And it is very developmentally dependent, as Dr. Sawani said. One kid who's 3 may be ready for swim lessons, and one kid who's 2 may be ready for swim lessons. So, great opportunity to talk about that at your next well child visit with your pediatrician to see, what is best for your child.
Yeah, absolutely. And keep in mind, your child might be a really good swimmer, but they get a splash of water in the face and take a breath in, and then suddenly they're next thing they know they're surrounded by water, and then you get confused which way's up, which way's down, and bad things can happen even in kids who know how to swim, and they do. That happens every summer, and so this is why it's just so important to have all of those different layers, including someone from the family watching your child in that pool all the time. Yeah,
that's such a great point. You could be an Olympic swimmer, but if someone, jumps on you, like if they're, it's a busy day at the pool and someone jumps on you and gives you a head injury, it doesn't matter that you're an Olympic swimmer, you have a head injury. And so if someone's not watching to be able to help you out, that can be a big problem. So yes, no matter the strength of the swimmer, you always want to have someone watching.
Yeah. I also want to mention a resource from the American Red Cross called Longfellow's Whale Tails resources, and it kind of supplements swimming lessons. It's a water safety program that's online. There's articles, resources, videos. You can get certificates of completion that are fun for kids, and so just a nice resource for parents. And I'll put a link to that in the show notes. It doesn't replace actual physical swimming lessons, but it can kind of supplement and provide reinforcement of rules for safety around pools. And that's what I wanted to talk about next, Sarah. What rules should parents enforce around pools and other bodies of water? That their kids need to know the rules and follow the rules. And if they can't follow the rules, then there are consequences. What are those rules that we should be really putting into place for our kids?
When we're thinking about drowning prevention, it's really important to kind of categorize it into two separate scenarios. So there's the times when the child's expected to be around water, right? And then there's the time when children are not expected to be in and around water. And so how do we keep them safe in that respect? And I think we're going to get to that in a couple minutes. But as far as when they're expected to be around water, Dr. Sawani already mentioned the water watcher. That's really critical because, when everybody's watching, nobody's actually watching. So identifying who that person is, what their responsibilities are. Obviously, if you're at the pool, you don't keep one water watcher for 3 hours. That's not really fair. But like having some sort of plan in place and identifying that person in that role. When you have beginner swimmers, keeping arm's length supervision is really important. Watching them from, 12 feet away is not helpful if the child can't swim. And it's not an age thing, right? It's a skill thing. So if you have a swimmer who is a novice, then you need to be within arm's length so you can grab them if something were to happen. We kind of have already touched on this, but just to really spell it out, never swimming without an adult supervision. Obviously, if there's a lifeguard available, that's ideal. You want to swim. If you're in an open water area, you want to swim in an area that is being watched by a lifeguard. At pools, you want to have a lifeguard. There's some times where, maybe you're at a hotel or a smaller community pool where there's not a lifeguard, then there has to be an adult watching. We already sort of touched on life jackets. So life jackets need to be Coast Guard approved, and they need to fit correctly, as Dr. Sawani mentioned, and also in good repair. So you want to make sure they're not ripped or torn in any way. Really important to wear those on any sort of watercraft, but also, as you mentioned, beginning swimmers, if they're even near the water, if they're out on the dock. When my boys were little and not super strong swimmers, they had to fish off the dock wearing a life jacket, just to really reinforce that message of safety and those layers of protection.
Yeah. So important. Some of the rules in terms of child behavior around the pool is going to be very important as well. One, I would say, unless your child knows how to dive and it is 9 feet of water or more, they need to get into the pool feet first, right? We don't want diving injuries can happen. They can cause head injuries, neck injuries when you get to the bottom of the pool. So we really want to teach our kids to get in with their feet first, right?
Yes. And I think when your child is going to a pool, maybe for the first time, it's not their regular pool where they know the depths of area and they know the diving areas. It's definitely a good idea to take a walk around the pool with your child and point out, okay, this is the shallow end, this is the deep end. It's, this many feet deep, you can dive here, or you cannot dive at all in this pool is really important. And then, similar rules hold true for open water. You want to be very careful about diving into open water. You never know what could be laying underneath the water. You don't know how deep it is necessarily, but, maybe a tree has fallen down since the last time your child swam in that space. You just want to be really, really careful, always entering open water areas feet first, to make sure initially that it's safe.
Yeah. You also mentioned, you could have someone jump on your child and they go underwater. So horseplay in the water is really not good. It's not the time to wrestle, right?
Yes. Ideally, no. As a mom of 3 boys, it's it's challenging. Again, which is why that supervision is so important.
Yeah. So you can, because as you're watching, you can get an idea of like, is this starting to get a little too rowdy, where there could be a problem? Because as you mentioned, you also want your kids to have fun. You want them to be physically active and exercising and outside. All also important things.
Very. But you also want to remind them that not, there may be younger kids in the area, so they really need to watch their space, or maybe there's a friend who's not as strong of a swimmer, so watching kind of which areas of the pool that they're in. So just those constant reminders that, water is super fun and great exercise, but you need to be respectful of the dangers and just planning appropriately.
Yeah. What about eating? We and chewing gum. I mean, we really don't want anything in our mouth. Water can get in there anyway, and we don't want something else that could choke us.
Mm-hmm. No, absolutely. Yeah, you shouldn't have anything in your mouth while you're swimming, jumping, or diving.
Yeah. Yeah. And then what about the drains at the pool? Kids should stay away from those, correct?
Yeah, absolutely. Everything from their feet, their hands, even their hair can get caught in the drain and trap kids and even adults underwater. So, there's some newer drain covers that have come out, and they're a little bit safer, but they're still not perfect. And so we recommend, safety systems to be in place. Those can kind of sense when drains are being blocked and kind of automatically shut things off. But another thing that you can do if you don't have the newer drain covers, or if you can't get the safety system, is just knowing where the actual pool pump is located. If you're at a friend's house, or if you're the designated water watcher, somebody to establish that. And then you can quickly shut off the pool pump if needed, just in case.
Yeah, that's a really good point. How do you make the suction stop? And then hot tubs, I wanted to mention those too, because I think during the pandemic, a lot of people got new hot tubs, and those can be dangerous for little ones as well. What are some rules that we should follow around the hot tub?
Yeah, I think just educating the kids that this is, not to be used without supervision, like Dr. Denny's been mentioning, and then trying to keep them covered constantly. If they're behind a fence, that's ideal, but I know some people keep them covered if they're not in use, and that's not only to keep them clean, but also to keep them safe. And we hear, even if you don't have young children in your house, it's still a good idea, just because neighbors, you never know. We hear stories that, hey, they got into the neighbor's yard and they fell in their pool or something like that. You never know what can happen. So it's really looking out for your kids, and even if you don't have kids, looking out for your neighbor's kids as well.
Yeah, absolutely. And hot tubs, keep the temperature down. If your kids are going to be in there, get in there with them, and stay for a short period of time. And if anyone starts feeling lightheaded or dizzy or funny, right?
Absolutely.
Let's talk a little bit about home pools and things that we can do to make those safe for our kids and for other kids in the neighborhood. And I'm thinking things like fences and gates and locks and all those things. Sarah, what are the rules that we should be following for our home pools to make sure that they're safe?
Well, I think, one of the important things to think about is keeping kids safe when they're not expected to be in and around the water. So the Consumer Product Safety Commission did a study, and in that study, they found that 69% of children less than 5 were not expected to be in or around the pool at the time of the drowning incident. The fact of the matter is, like, we all obviously train watch our kids as closely as we can, but sometimes we have to cook dinner or go to the bathroom or, something. You can't have eyes on your children all the time. Now, when they're in the water, 100%, you have to have eyes on your children all the time. But when they're not expected to be around water is when we have to think about other ways of keeping them safe. So the most effective evidence-based strategy to keep kids safe around water in general, but home pools as well, is four-sided fencing. And four-sided fencing needs to completely enclose the pool. The house does not count as one side of that fence. So we want to have a self-closing, self-locking, or latching gate that prevents, the gate from being left open and a child wandering in. There are some other potential strategies for keeping kids safe around home pools. There's not been published evidence, so I want to make sure your listeners definitely use these as additional layers in addition to the four-sided fencing, but pool covers, door alarms, and pool alarms are other additional layers that you could consider. But again, there's no evidence to show that, yes, they have in fact prevented a drowning death. And then in the home, never leaving your child alone in the bathtub, getting a toilet latch for your toilets if you have toddlers, and then always emptying any buckets of water, or you mentioned those small portable kiddie pools, emptying those as soon as your child is done playing in it or using it, so there's no standing water.
Yeah, absolutely. One area where I feel like this gets a little bit compromised is in warmer climates than here in Ohio, where folks may have a pool that's all year and they have a lanai, like a screened-in enclosure that's right off the back of their house. And so their pool is just right there, and it doesn't make a lot of sense for there to be a fence inside the lanai. But that is something that you could do. It kind of breaks things up a little bit. And, we travel to places where these pools are, and you really don't see fences inside those lanais, right?
They could easily come right out that sliding door and gain access. You are turned around doing one thing and it just takes a second for a child to slip out. So yes, those fences definitely are available, as you mentioned. And then, you could maybe pair that with a door chime. Every time that sliding door opens, a chime goes off or something like that. But again, different layers of protection. But the standard would be to have that fenced. The other thing is, if you mentioned going to visit or being in a rental property, it's important to kind of assess the situation when you are at a new location where there may be water, and then make sure you're taking appropriate safety measures, having those conversations, and going from there.
Yeah.
I think one thing important too is like removing all toys from the pool too. That's something I didn't think about, but kids, they might not be wanting to just go in the water. They just left their toy in there, or they see something that catches their eye and they go to reach for it and they fall in. That's a very common thing we hear as well. So just getting rid of everything when you're not using the pool, just get rid of all the toys and keep them away from it. So that's not another temptation for the kids to go near their pool.
Yeah. Public pools have, safety inspections. Someone goes around and makes sure that the safety equipment everything's in working order, that the ladders are, in place and secure. And I feel like that doesn't always happen with home pools. So it is important to make sure everything is working properly, and that you have some safety equipment around, correct?
Absolutely.
What kind of safety equipment should we have?
Well, everyone who has a pool should have someone who knows CPR for sure. Obviously, quick access to a phone so you can activate the emergency medical system. A way to get a child out of the pool. So like a pole or a hook or something, not just a child, I shouldn't say that, because really there's adults that also drown in pools. So, having some form of rescue equipment, having a flotation device also would be recommended.
Yeah, absolutely. Where there's water in the home, like pools and hot tubs, there's often also pool chemicals. And I just wanted to put a shout out that although we're talking about water safety, we also have to think about chemical safety, and that kids, may come along. A lot of times these liquids have fun colors, they may be blue or green and look very inviting for a child to want to maybe take a drink and see what that tastes like, because it looks like Kool-Aid. But we really want to keep that stuff locked up. So something else to think about. And then we've talked about public pools and home pools. Ali, summer camps often also have pools, and those can get pretty crowded. And, they may only have one lifeguard looking at the whole pool. What questions should parents ask if their child's going to go to camp and there's a pool there, to make sure that camp is thinking about the safety of their little swimmers?
Yeah, I think it's a lot of the things we've talked about, just kind of seeing that if it's the pool is protected in off hours as well, like Dr. Denny was mentioned, if it's fenced in. And I think also kind of this is a good time to, if your kids are going off without you, just kind of reiterating your rules for being around the pool is you're not allowed to get in without an adult present. We hear stories about kids, sneaking out or going with their friends or something like that. They really should only get in pools when there is adult presence. And then I know a lot of these summer camps, they go out on boats, on lakes and stuff like that. They go rafting. Those are all kind of things we hear. And again, reiterating, they have to wear life jackets, and making sure the summer camp provides the correct size life jackets. And then, just reminding your child as well to never swim alone. Pay attention to all the warnings, because it's a new environment. You might not be there to show them all those things like we talked about, like the depth of a pool and kind of those kind of things. So kind of reminding your kids to check all those things. And then it's a good time to also reiterate about staying out of water during storms and lightning, and then not diving into lakes and those kind of things. But I think the biggest thing is just making sure that the children will be supervised at these summer camps.
Yeah, absolutely. And that there's an appropriate ratio of lifeguards to the number of kids in the pool at a time. And I think that's where some of these camps can get into trouble depending on what state you live in. Different states have different regulations. Some don't regulate it at all in terms of, do you need certified lifeguards? Can it just be camp staff? How many of them? What's their experience level? And all of those things. So tragedies can certainly happen at camp, and we want to prevent those.
Yeah, like Dr. Denny mentioned, making sure there's multiple CPR trained supervisors at the camp as well is a good idea.
Yeah. So Sarah, let's talk about emergencies in the water. What steps should someone take if they see that someone's having difficulty in the water?
Well, it certainly depends on the level of training and ability of the people who are there. We certainly don't want someone jumping in deep water who doesn't know how to swim. So in that instance, extending something that the struggling swimmer could reach out to, like a long pole, would be appropriate. Now, if there's already been a submersion, we know that rapid initiation of CPR is the most effective way to improve outcomes. So, starting CPR, ideally, one person starts CPR, one person calls 911. If the person is still conscious but struggling, then depending on the level of the adults supervising, they could go in after the pool or after the swimmer. However, as Dr. Sawani mentioned, you need to make sure that the area is safe. So if there's any electrical involvement, we obviously would not want someone jumping in that instance. So the ideal thing is to not just have someone jump in after someone, but to offer some sort of rescue equipment so that we don't end up with multiple victims.
Yeah, absolutely. I'm a big believer that all parents should know CPR. That everybody should know CPR. And the great news is that the American Red Cross has classes in just about every community across the country. And we are going to put a link in the show notes to the American Red Cross, their page on where you can find a local class to learn CPR, because it's such an important skill. And then there's also a resource from the American Red Cross called Reach or Throw, Don't Go. And it's a safety guide and activity book that for both adults and kids that just give you an idea of the steps to take if someone's having trouble in the water. So I'll put a link to that in the show notes as well.
That's a really great point, because even the lifeguards, if you've ever watched a lifeguard make a save, they don't just jump in the water, right? They jump in with some sort of rescue equipment to avoid any sort of obviously the person who's struggling is going to reach for anything, whether it's a person or a device. So we don't want, them reaching for a person and pulling them under as well. So that reach or throw, don't go is a great reminder to, have something, if you can reach it out to them or to throw it to them, that will help, get them above the water.
Yeah. And I think there's some coloring pages with that. And it's always fun, like, to learn a little lesson while you're also having fun and coloring. And that usually works pretty well for the little kids. Ali, I wanted to ask, how do you incorporate these messages in your pediatric practice? And we have a lot of pediatricians who also listen to this show. There's so many things that we want to talk about at well checkups, and the list grows as people, have their own interest and want pediatricians to talk about this and that and the other thing. How can we incorporate these messages in an efficient way in our practices?
Yeah, that's a great question. I think just asking these questions, like, I know for me, when my newborns are kind of starting to crawl and stuff like that, I ask parents about if their house is childproof. I think that's a really good opportunity to talk about, like, water safety, because they can, in the bathtub and stuff like that, if the children are now sitting, kind of reminding parents, especially new parents. Like I said, I didn't know about a lot of this stuff until I became a medical professional. So these are things that maybe they didn't think about, like, any amount of water is dangerous for a child. I know a common question that I like to ask, especially coming up to the summer, is what children are doing during their summer break. So if they're planning on swimming or, going to a summer camp or something like that, that's a good opportunity to bring some of these things up. And just efficiency wise, you can add them. Some providers have like questionnaires that they have, child or children or parents fill out. So you can add some of these questions really easily, so you can kind of target what you want to talk about. Another good thing, I currently practice at one of our community sites, and it's kind of a lower income area. So I think one thing that we've kind of done is look for resources in the community, because swimming lessons can be expensive, but there are a lot of community services that provide free lessons or reduced rates or things like that. So I'm hesitant, to encourage swimming lessons to a family that might not be able to afford them. So if I know the resources, then I can kind of point them in those directions. So I'm not just saying, hey, like, your child should have swimming lessons, and then that's all. I'm not really giving them any resources to do that, safely or appropriately. And also just providers, just reminding about pool safety, like I mentioned. And I think just providing those resources, and you don't have to talk about all of them. You can have signs up. The American Academy of Pediatrics has really good, posters and stuff that you can put around your office. And the summertime is probably a good time to do that. They're like well illustrated, and they're kind of, like you said, they're colorful and eye catching. So those are really good resources as well. So, what we're talking about efficiency, even if you don't have the time, you can just, remind them to look at them, or while they're waiting, that's something that they can see as well.
I really like talking, like while I'm doing my exam, I often just ask the child, do you know how to swim? And I'm so surprised, but it's also a great teaching opportunity for everyone in the room. Every kid says yes, every single kid. And so then I'm like, well, if you're in water that's over your head, can you get up to the surface and over to safety? And then the answer usually changes. So that's a great opportunity for me to point out to the parent, like, the kid thinks they can swim, but they can't. And this is why swimming lessons are so important. So it's a really good opportunity to have that conversation. And I'm doing the exam while I'm having the conversation. So it's not taking any extra time, but it could save a life.
Yeah. It's a really important topic. And this is a great time of the year to bring it up as we start to head into warmer weather here in the Midwest. And so, definitely at least have those posters up and talk about it if you can, because it's really, as you said, you could save a life. It's that important. One place that we've not really talked about pools is in schools. Some schools have swim teams, and they may have a pool. Ali, basically it's the same stuff, right? I mean, there should be people at that school who are invested in water safety and is making sure that all of the rules that we've been talking about are being followed.
Yeah, exactly. I think it's the same thing that applies, like making sure, hopefully the swim coach or somebody is there. And then, anybody involved, like we've been talking about, is CPR trained, and, they're just being monitored. And, if it depends on the type of school, but, kind of same thing, like make sure they're fenced in, or if they're in like an indoor pool, make sure it's locked and it doesn't have easy access. Those kind of things are really important to keep in mind.
And then Dr. Sawani's point, if the school district has a pool, providing that as a free opportunity to get swim lessons to maybe the younger kids in the district. So I'm really getting creative on ways that we can support our community and provide increased access to swimming lessons.
Yeah, absolutely. I want to point out a resource that I had mentioned a bit earlier in the program, and that is the American Academy of Pediatrics policy statement on prevention of drowning. It was published in 2019. I'm going to have a link to that document in the show notes so that folks can find it. Sarah, you were the lead author of that. Is that something that would be helpful for community pools and school pools and even parents with a backyard pool? This may have some really helpful information and pediatricians who are counseling families. What are the most important points to bring up? All of these things can be found in that policy statement, right?
Correct. And especially at the end of the policy statement, there's recommendations for what communities can do, what pediatricians can do. There's definitely a lot of advocacy opportunities around drowning safety. And then if you really want to do a deeper dive, the technical report really goes into the data behind those recommendations. So that is also available on the internet. But yeah, I can't emphasize enough, like this is not just a parent problem or not just a pediatrician problem. It's an everyone problem. Like we've got to do a better job of keeping kids safe because this is a preventable mechanism of injury and death.
Yeah. And so again, it is the number one preventable death in kids, injury-related death in kids under
1 to 4
years of age.
Mm-hmm.
Yeah. So really, if you got those young kids at home, this is super, super important. Before we go, we mentioned advocacy education and why it's important for residents and for physicians, practicing physicians too. What kind of training do we offer at Nationwide Children's Hospital, Sarah, for our pediatric residents to help them to get active and involved in advocacy?
We're doing a lot of things, a lot of exciting, great things at Nationwide Children's Hospital. So currently, every resident participates in a 2-week advocacy and community health rotation. I'm super excited to share that we will be expanding this to 4 weeks in 2024. So that is something that all residents get, all pediatric residents get. And as you mentioned in your opening commentary, this is a professional obligation and really a privilege that we're able to advocate for kids as pediatricians. And so really trying to give our residents the skills to make them incredibly effective advocates. We also offer an advocacy elective, and then we have our advocacy advanced competency, which is a 2-year kind of advanced training that residents can opt into. And they get, retreats and evening sessions. And they do a project as part of that. Dr. Sawani is one of our advocacy advanced competency residents. And then we have a lot of other opportunities. So Dr. Sawani just came back from Washington, D.C., where he went and attended the AAP Legislative Conference. We do a state advocacy day. We have a lot of other opportunities that come up that our advocacy residents are able to participate in. And then actually recently, we just rolled out a faculty development advocacy training because, as you mentioned in residency, back in the day when you and I trained, we didn't get a lot of this. And so now we're trying to get the faculty also trained up on advocacy so that we can continue to teach and model that for our residents and our medical students.
And in multiple instances in the past, the advocacy groups have reached out and had PediaCast be a part of their advocacy work. And we really appreciate that. That's kind of how this particular program got started. And we have several more episodes this year planned that center around advocacy efforts for kids and really get our pediatric residents involved, which I love. So Ali, thank you so much for stopping by today. And in fact, I want to thank both of you. Folks, remember, we do have all those resources in the show notes for you over at PediaCast.org. This is episode 536, and we'll put links again to the American Red Cross, to the Longfellow's Whale Tales, and that prevention of drowning policy statement from the American Academy of Pediatrics, and the Pediatric Residency Program at Nationwide Children's if you'd like to learn more about that. So once again, Dr. Sarah Denny with Primary Care Pediatrics and Dr. Ali Sawani, Pediatric Resident, both of them from Nationwide Children's Hospital. Thank you so much for stopping by and chatting with us today.
Thanks for having us.
Yeah, thank you. This was great.
are back with just enough time to say thanks once again to all of you for taking time out of your day and making PediaCast a part of it. Really do appreciate that. Also, thanks to our guests this week, Dr. Sarah Denny with Primary Care Pediatrics at Nationwide Children's and Dr. Ali Sawani, Pediatric resident also at Nationwide Children's Hospital. Don't forget you can find PediaCast wherever podcasts are found. We're in the Apple and Google podcast apps, iHeartRadio, Spotify, SoundCloud, Amazon Music, and most other podcast apps for iOS and Android. Our landing site is PediaCast.org. You'll find our entire archive of past programs there, along with show notes for each of the episodes, our terms of use agreement, and that handy contact page if you would like to suggest a future topic for the program. Reviews are helpful wherever you get your podcasts. We always appreciate when you share your thoughts about the show, and we love connecting with you on social media. You'll find us on Facebook, Twitter, LinkedIn, and Instagram. Simply search for PediaCast. Also, don't forget about our sibling podcast, PediaCast CME. That stands for Continuing Medical Education. It's similar to this program. We do turn the science up a couple notches and offer free continuing medical education credit for those who listen. And it's Category 1 credit. And did I mention it's free? And that includes doctors, nurse practitioners, physician assistants, nurses, pharmacists, psychologists, social workers, and dentists. And since Nationwide Children's is jointly accredited by all of those professional organizations, it's likely we offer the exact credits you need to fulfill your state's continuing medical education requirements. Of course, you want to be sure the content of the episode matches your scope of practice. Shows and details are available at the landing site for that program, PediaCastCME.org. You can also listen wherever podcasts are found. Simply search for PediaCast CME. Thanks again for stopping by, and until next time, this is Dr. Mike saying stay safe, stay healthy, and stay involved with your kids. So long, everybody.
This program is a production of Nationwide Children's. Thanks for listening. We'll see you next time on PediaCast.